Welcome to Remedy that makes you feel better. This is a continuation video to the last topic, what to do if you miss a dose. In general, skipping a dose is not a big deal, but it's more important how we handle it. Some may skip it completely and some may overlook and double it without proper consult. This video focuses the importance of never make dose adjustment on your own, or by doing so, what are the consequences we face. With reference to that context, let's see some examples of meds used to treat specific conditions and how to handle the missing dose. First one is IBP. Here are some examples: amlodipine, lisinopril, losartan, and metoprolol. If you miss the dose, which is within the grace period of 1 to 2 hours, take the med as soon as you remember. You can also skip the dose if it is close to the next dose and take the next scheduled dose at the regular time. But if you double up the dose, it can cause sudden drop in BP, leading to dizziness and fainting. Also may affect the heart, leading to irregular heartbeat and other heart issues. So avoid doubling up the dose. Second one is diabetes. Examples of meds: metformin, glipizide, sitagliptin, and insulin. Missing dose instruction is as same as IBP if it is in tablet form. Otherwise, if it is an insulin injection, follow your doctor's advice on adjusting the dose if you miss it. If you double up the dose, it causes low blood sugar level, which can be dangerous, leading to symptoms like sweating, confusion, shakiness, and in severe cases, loss of consciousness could happen. So strictly do not double up the dose. Third one is high cholesterol. Examples of meds: atorvastatin, simvastatin, rosuvastatin, etc. The instruction for missing a dose is as same as IBP and diabetes, but doubling the dose can increase the risk of side effects like muscle pain and liver problems. Also, it will not provide any additional benefit, rather can be harmful. Fourth one, thyroid problem. Examples: methimazole, propylthiouracil. In general, the meds are advised to be taken in the morning in empty stomach. But if you forget until lunchtime, hold off your lunch until you have taken the med and leave an hour to pass, then take your lunch. Similarly, if you usually take med before bed but you forgot, try taking it in the morning before eating and then resume your schedule. But never double up the dose. If you do so, can lead to oversuppression of thyroid hormones, causing low thyroid hormone level. It may also increase the adverse reactions like allergic reactions, liver problem, joint pain, GI symptoms, temporary skin discoloration, bone marrow suppression, etc. So please do not double up the dose to make up the missed one. Fifth one is pain. Examples of meds: acetaminophen, ibuprofen, naproxen. In conditions like arthritis, some pain meds works best if you treat the symptoms before they start. Otherwise, pain flares up and may be difficult to suppress. In case of missing a dose, take the med as soon as you remember if it is appropriate based on dosing interval. Do not double up the dose. If you double up, it increases the risk of side effects, especially meds like acetaminophen, which can cause liver damage when taken in excessive amount. Sixth one is antibiotics. Examples: amoxicillin, azithromycin, cephalexin. These meds are usually taken once, twice, thrice, or 4 times a day. The dose should be equally spread throughout the day and taken at the same time each day. This helps in maintaining a constant level of med in your bloodstream. In case of missing a dose, take the med as soon as you remember. But if it is near to the second dose, skip the first dose and never double up for compensation. Doubling the dose, though, will not cause long-term damage, but one can experience adverse side effects like nausea, vomiting, diarrhea, and other GI issues. Additionally, some meds like anti-seizure meds, immunosuppressants, anti-arrhythmic agents have narrow therapeutic index. Means a slight increase in the dose can be toxic, a slight decrease in the dose can be ineffective. So right dose at right interval should be given. Missing even a single dose can produce symptoms. And there are meds like BCP, that is birth control pills. Missing a dose can lead to unintended pregnancy. Even one pill is missed, you may be instructed to take two pills the next day. That is one pill as soon as you remember and the next dose at regular time. This is done to help maintain contraceptive efficacy. Here, doubling up is permitted. Overall, these examples emphasizes the importance of following instructions provided by your doctor or the med label. And doubling the dose to compensate the missed one is not a safe practice for most meds. With this, we have come to the end of this video. I hope this video is informative and useful. Thanks for your attention. Adios amigo.